Good morning. It's such a privilege to be able to present to you today. My name is Seppala. I'm a faculty member at the Yale School of Management, and I will be presenting some research that colleagues and I have conducted on sky breath meditation. So I'll start by sharing my slides. So what we'll discuss is a few studies, but first I'm going to give you an overview of the field of research that I am trained in, which is emotion research. So I was in a lab at Stanford as a graduate student where we looked specifically at how people regulate their emotions. And so you can think for yourself, how do we manage our emotions for optimal outcomes? What do we learn about emotion regulation growing up in our general communities and workplaces? If you ask yourself this question, and I've asked this question to people from all around the world, one answer seems to always appear as most frequently, which is suppression, which is basically when you feel a big bad negative emotions, anger or anything else, you tend to suppress it or ignore it or try not to show it. And so what our colleagues have found is the impact of this very popular technique that is used all over the world, more frequently than any other, is that actually the impact of suppressing an emotion like anger magnifies it. So we know, for example, that anger makes your blood pressure rise, your heart rate increases, your fight or flight sympathetic nervous system gets activated. But what happens when you suppress the emotion? All of those systems actually get activated all the more. It's as if you take a soda can and you shake it up. What happens? It's inevitable then that suppression leads to either explosions at some point. I think we've all experienced that or seen it happen anyway. Or it can lead to implosions, psychosomatic reactions, migraines, stomach aches, etc., if the emotions are bottled up, and also can come out as sort of passive aggression. So lots of different outcomes, but none of them are actually beneficial. So it's so ironic that this technique that most of us have learned to use, mostly because our parents didn't know any better either, is that it has these negative outcomes. And if you actually look at people who suppress a lot and their relationship outcomes, it negatively impacts their relationships, which is so ironic when you think about it, because why do we suppress our emotions? It's often because we want to maintain an air of civility with another person. And yet, unfortunately, when we suppress, we end up harming our relationships. So psychologists have looked at another technique that is much more successful, which is called reappraisal. And you may have heard about this if you've gone to therapy or heard about any kind of therapeutic treatments. Cognitive reappraisal means looking at the situation from a different perspective. For example, let's say you set 3 months of your life aside to apply for a dream job, and you put everything else aside and really just focused on that. And at the end of the 3 months, you don't get the job. So one reaction could be going down a negative rabbit hole of, oh my gosh, I wasted so much time and I'm a failure and so forth and so on. But reappraisal would look at the situation and think, okay, I did set 3 months of my life aside, but I learned so much. My resume looks so good. I'm now so much more prepared if this kind of job opportunity arises again. So reappraisal, science has found, really does benefit you and decreases the negative emotion, and really it has beneficial outcomes for us. Now I'm just going to show you what this looks like at the level of the brain. So we know that when we suppress our emotions, if you look at this picture here of the emotion centers in the brain, you actually have increased activity in the emotion centers. So by suppressing our emotions, we actually experience them more, and they are more destructive, as opposed to reappraisal. When you're able to sort of apply logic, reasoning, wisdom, then you're able to decrease the emotional activity in those emotion centers. So how does this work? So you've probably all heard about the prefrontal cortex, which is so well developed in humans. And thanks to the prefrontal cortex, we're able to apply logic, reasoning, wisdom, and to calm down the emotion centers, which are located in a deeper part of the brain. We share these emotion centers also with the brains of animals and so forth. And so this is what's so unique about humans. We are able to apply reason and rationality to downplay emotions. Now, for example, saying, okay, you know what? I didn't waste those 3 months. I learned so much. But here's the question for you. Have you ever noticed that sometimes we can feel really strong emotions, and there's no way that you can talk your way out of that emotion, or someone else? You know, I think about how helpful it is when someone else comes up to you when you're feeling very anxious and they say, hey, you should just calm down, right? That's just not helpful. And at that moment, this is why we're not able to regulate our emotions. And this was also my question when I was in that lab at Stanford. I thought, yes, reappraisal works, but there are these instances when we have a really strong emotion, and in that moment, we can't talk our way out of it. So what then, right? So let me just show you why this is the case. In high stress situations, or in moments when the emotions are really strong, you actually get loss of prefrontal regulation. You no longer have access to your faculties of logic and reasoning in those moments. And think about how helpful it is to try and talk a child out of a tantrum. There is no reason that will work with them. But in many ways, as adults, when we have those strong emotions, we are no more equipped than a child having a tantrum, because we also have loss of this ability to think rationally and logically and to reappraise. So what then? What now? And that was always my question in graduate school. What about those moments when it's just not possible to reason our way out of it? So I'm going to share with you a quick story now. About 9 or 10 years ago, my husband walked in the room and he was pale. And I said, what happened? And he said Jake was in an IED. So Jake was his friend, an officer in charge of the last Humvee on a convoy going across Afghanistan. And all of the vehicles had passed safely except Jake's. Jake's had driven over a roadside bomb. And in that moment, we can't even imagine what that would feel like. The trauma of just the physical shock, the loud noises, the shrapnel flying, and the excruciating pain of physical injury. So in that moment, as the dust settled and he looked down, he saw his legs were almost completely severed below the knee. Now, usually this would be a moment of trauma and shock that would send someone into an unconscious state. They would faint, right? But in that moment, Jake remembered something. He remembered a breathing exercise that he had learned. And he started to engage in that breathing exercise. And because he did that, he was able to regain his ability to think logically and rationally. He calmed the system down enough to regain access to the prefrontal cortex and to do his first act of duty, which was to check on the other service members in the vehicle, to do his second act of duty, which was to give orders to call for help. And finally, it gave him the presence of mind to tourniquet his own legs and to think of propping them upward before he fell unconscious. Now, he was told that had he not done that, he would have bled to death that day. So why do I share this story? If a breathing exercise can help someone in that kind of a dire situation, what can it not do for many of us who encounter less stressful situations and yet encounter stress on a regular schedule in our lives? This is just a fact, right? So this is something that my colleagues and I ended up really devoting a lot of time to. Is there a way to regulate our emotions that is so powerful that it allows us this ability to regain access to our logical mind? Really quickly here, the psychological paradigms so far have been very mind-driven, top-down. I think, therefore I am. Change your thoughts, change your life. You've seen these books. And yet, as you just saw when I was sharing about these slides on the brain, this is not always possible when we have strong emotions. We can't talk our way out of them. And this is where a new paradigm is emerging, where can we shift the nervous system at the level of the body using breathing, and thereby regain access to our ability to think logically and with wisdom. So research has shown that when we feel different emotions, it changes the way that we breathe. But what's most interesting about this research is that the scientists found that when we actually give people instructions to breathe a certain way that corresponds to the emotion, right? If we give them instructions to breathe the way you would when you're angry, what happens is that those participants start to feel the emotions, even when they haven't been told that the breathing pattern they are engaging in corresponds to an emotion. So what does this mean? It's very difficult to talk our way out of emotions, but we can use the breath, as Jake did. Actors know about this. Actors are trained in this in drama school, to use their breath to evoke an emotion. So we actually wanted to look at this with students, undergraduates at Yale. College students in general will get more burned out over time. I know that in Denmark, there is a huge issue with student and adolescent well-being and mental health. The same is true in the United States, and the same is true at Yale University, where students tend to be very high achieving and very hard on themselves, and burnout increases over the course of the semester, as do mental health issues and problems. So what we wanted to do was, let's look at 3 different well-being interventions compared to a control group and see which well-being intervention has the most impact on student well-being. So we randomly assigned students to one of 4 groups. One was the Sky Breath meditation group. One was a mindfulness-based stress reduction group, which has been well researched. And the third was an emotional intelligence program that focused on cognitive skills and that we had developed at Yale. And the fourth was a control group. And what was very interesting is that although all of the groups benefited the students to a certain degree, except for the control group, of course, the Sky Breath meditation was far and above the others in terms of showing a statistically significant impact on well-being when compared to the control group. In particular, it lowered stress and depression, improved mental health, improved social connectedness, improved positive emotions, and mindfulness. Now, again, they did this program over the course of a semester, and it was as if it buffered them against the stress that they would normally be experiencing and feeling. So colleagues at Harvard actually ran a very similar study, randomly assigning students to a Sky Breath meditation program or a cognitive control, again, learning those emotional intelligence skills. And what they found were very similar results to us, but in addition, they measured the physiological well-being. And so, for example, they placed students into a situation that was stressful. They were asked, hey, you're going to have a seat here, and we're going to measure your heart rate and blood pressure, etc. And you're just going to sit here, and in about a few minutes, you're going to be going on stage to deliver a talk on a topic that you're not familiar with in front of an audience. So this is usually a stressful scenario for people. And what the scientists found was that those students that had been assigned to learn the Sky Breath meditation showed less of a stress response than the cognitive group. So less anticipatory anxiety, which is really what anxiety is. So this is kind of huge because, of course, it's wonderful to get these self-reported results on questionnaires as we did and as the Harvard did as well. It's also really nice to get physiological correlates showing that even at the level of the body, you're actually seeing that what they're reporting is true. So one study, which I will also mention that I don't have a slide for because it's conducted by a colleague with teenagers at UCLA. My colleague Dara Garamani ran a study looking at at-risk teenagers and examining whether they might become more likely to engage in substance abuse. And what he found is that those students that had gone through the Sky program were less likely to become impulsive, became less impulsive. In a sense, impulsivity, we know, is a predictor of substance abuse problems in the future. So that was another really nice finding related to students. And at this time, when we know student mental health and well-being is such a challenge, and we see this across universities in the United States, there's literally a mental health crisis that has been happening over the last decade, even prior to the pandemic years. So we can't keep throwing psychological treatments at them. This is what many universities have been doing. Let's just add more psychologists, add more psychiatrists. But the problem is you can't keep doing that financially, and it's not solving the problem. Can we teach students ahead of time? Can we make a resilience trainings part of the curriculum, or can we offer these before students enter a university setting so they have the tools with which to help themselves? So another population that we worked with were veterans with a post-traumatic stress. I learned sky breath meditation myself after surviving 9/11 in New York City. Now, this was back when I was in my early 20s, and I had tried many things to try and regulate my anxiety, and this was what had worked. And I had continued it as a personal practice and then gone into my psychology studies and academic work and so forth. It wasn't until 10 or 12 years later that I was invited to work with veterans coming back from Iraq and Afghanistan. And I looked at the research, and it showed that many veterans were not getting help by traditional treatments, either therapeutic treatments or pharmaceutical treatments. Many of those who went through an entire course of treatment did not benefit, and another big percentage dropped out because they found those treatments aversive and they could not complete them. So this was leaving a huge gap of veterans who were not being helped, who were living in their basements, who were at risk for suicide, who were on drugs or alcohol just to try and make it through the days and the sleepless nights. So harking back to that time after 9/11, we thought, well, let's see if a breathing practice could help them. And so we actually had a group of veterans go through the sky breath meditation protocol, and another group who did not. And these were veterans with varying degrees of post-traumatic stress. So if you look over here at this graph, you'll see that the blue group was the control group. So, and the red group was the group that went through the program. Now, time one was right before the program started. Time two, you see that the blue group remained steady, but the active group saw a significant decrease in post-traumatic stress, in anxiety symptoms that was maintained 1 month later and 1 year later. So right after the program, they showed improvement, but also 1 month and 1 year later. Now, this is extremely unusual. We do not expect these kind of findings, and we were quite surprised, but it is as if when the veterans go through this several days of this program, it recalibrates their nervous system back to a place of normality. And that's what and even though many of them did not continue the practice, because this is a question that comes up, well, did they continue practicing? Is that why there's this continued improvement? Most of them did not. They came and joined the study because they were being paid. They definitely benefited, but they didn't continue. But it didn't actually matter because the benefits were sustained, which was it was quite extraordinary. Their anxiety had returned to a normalized state. And if you think about post-traumatic stress as being locked into a fight or flight sympathetic nervous system activation constantly, what it seems that sky breath meditation does is it resets your nervous system to a place of normality so that you are not constantly in this high anxiety state. Now, again, we looked at physiological measures. In particular, we looked at startle response, which is how much someone physiologically startles in response to a loud noise, because again, we wanted to measure whether we could see in their body what they were reporting in the questionnaires. And we found that the more their anxiety reduced, the less startle response they had at this correlation 0.9, which is very strong. So giving us confidence in our findings. And you see here an image of one of the veterans wearing the startle sensors. And the reason I'm allowed to show you this image is because this veteran gave me permission, because there's a documentary that was made on this study by a Danish filmmaker called Fie Ambo. The film is called Free the Mind. I recommend watching it if you'd like to see the experience of these veterans and how much they benefited from the program. We actually just completed a study at the Palo Alto Veterans Affairs Hospital with a larger cohort, almost 100 veterans, who what we did was we compared a group that went through sky breath meditation with a group that went through traditional treatment, cognitive behavioral therapy. And the statistical model was to see, is sky breath meditation inferior to traditional therapy or not? And what we found was that, in fact, it was not. So the statistical method that we looked at looks at whether it's significantly different from those who went through cognitive behavioral therapy, and it is not. So it may actually either, it has similar or better effects than cognitive behavioral therapy, which is really encouraging, because we know, again, that many veterans don't want to go through certain therapies because they have to talk about their trauma, etc. And so here's a therapy that is doesn't involve talking, just involves breathing, and can have so much benefit. So I just wanted to thank you so much for listening to this today. And I'm really available for questions and collaborations. So please feel free to reach out to me at any point. And I hope you have a wonderful day.